and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. Man, if you're new to us, we're super excited to have you here because we're bringing some pretty phenomenal people, exciting conversations of leaders that are painstakingly changing the shaping of the future of our healthcare delivery system. And we're really passionate around healthcare innovation, adoption, and more importantly, access. And access means different things to different people. But for me, access means access to things like care, food, shelter, access to opportunity, access to information. And today we get to really kind of tune in. So before I dig in and dive into the introduction of our guest, let me just sort of take a step back and tell you a little bit more about what we're doing here. So we're a healthcare innovation company, and we're focused on bringing stories of innovation to life. And the aim is just to highlight real people that are doing really, really awesome work, that are in the trenches, that are truly innovating within our space, and just giving them the opportunity to share their stories with our community and ultimately with the world. And we've just got an amazing, action-packed year of incredible guests. If you haven't had the opportunity to check out any historical episodes, make sure that you hit the subscribe button now, hit the bell, whatever you want to call it. Participate. We'd love to have you join. So our field is changing dramatically. It's changing fast, and it's essential to have leaders who see the future, embrace new ideas, and know what to do in terms of putting these ideas into practice, taking action, and doing it at scale. And our next guest on the show is one of these leaders. Adam Dole is the co-founder of Bento. It's a food-first company that combats food insecurity by providing stigma-free access to nutritious meals from local restaurants and grocery stores through a simple SMS platform supporting health management and community well-being. Simply put, they are meeting people where they're at on their journey. And Adam's not the type to kind of really boast about himself and things that he've done, but let me just do that a little bit for him right now. His track record is super impressive, which spans from either spearheading efforts at Not Impossible Labs and Go-Kart Labs to infusing strategic insights at Better, backed by the Mayo Clinic. And Adam also has done, I'll call this a tour of duty, where he was a presidential innovation fellow at the White House. He essentially showed an amazing skill for blending new ideas with effective, just navigating his way through government. And this work raised the bar for public health and for how we use technology in healthcare. So today he joins us from sunny LA, and we're going to kind of take a deep dive into his vision for the future in terms of where healthcare isn't just accessible, rather how it can be accessible and intuitive. So hopefully we'll go through some of the stories of learnings throughout his journey and peeking sort of where he sees the puck going and for the future. So Adam, it's great to see you. Welcome to the show. How are you?
Thank you so much, Michael. Thank you for that kind introduction and for having me on the show. Excited to be here.
Awesome, man. So let's before we kind of dig into Bento, I always like to kind of take some time for people to share their story. Would you maybe mind giving the audience a little bit more flavor in terms of, who's Adam Dole?
Absolutely. Well, my story begins growing up in a household where my dad was a physician and my mom was a nurse. And so growing up, I was surrounded by caregivers that exuded the human centricity that we all hope our healthcare system would have. And so I was exposed to a very, I think, unique set of skill sets and aspirations growing up that I recognize is very unique, that not everybody has growing up. But it really set this bar for what I expect out of our healthcare system, meeting people where they are, taking the time to understand what people's unmet needs are, and putting the best solutions in place to improve the quality of their life. And as I started my career, I was working at NASA in the human factors department there, understanding the unmet needs of the astronauts. and got really inspired to use the human-centered design process to have a larger impact on society, greater than just the 60 or 70 astronauts. And so I went back to my roots, growing up in that household of health caregivers, and started asking a bunch of naive questions of why our healthcare system is the way that it is, and quite frankly, didn't like the answers that I was given from a lot of quote unquote experts.
Yeah.
And I think if anyone's experienced healthcare in the United States, not sure it actually abides by the definition of the word system. That requires a level of coordination that I'm not sure everyone would experience going through their patient journey or caregiver journey. And I wanted to change that. And so I've been very fortunate to have the opportunity to be on a lot of unique teams with a lot of incredible air cover to be able to do some amazing work with amazing people to continue to chip away at my vision, which is creating a healthcare system that works better for people, and recognizing that we can't continue to do the things that we've done as a healthcare system and expect different types of outcomes and results without changing things up and approaching things from a different lens.
Love that perspective. So if we sort of fast forward in terms of what you're doing now with Bento, and when I started kind of digging in and researching and thinking about it, my background's in psych, so I'm kind of a nerd when it comes to that. But I'm thinking about Maslow's hierarchy of needs, and the base of the pyramid is really around sort of food and shelter. What was it about this? I'll call it the food insecurity that really piqued you to kind of really dig in and look into this. Can you maybe sort of share how you sort of landed on this? And then knowing that this is a massive problem, how do you start to kind of wrangle your arms around how to even solve this?
Yeah, so the story behind Bento starts while I was a managing director at Not Possible Labs. For those that might not be familiar with Not Possible Labs, super cool company based in Los Angeles that focuses on the creation of what we refer to as technology for the sake of humanity. And the end results are typically solutions that address what we refer to as humanitarian absurdities, things in society that are putting people's quality of life at risk, that are really preventable, and that we can use almost current state technology to address these things today and not wait for large bureaucracies to get on board with new policy changes and other things to make an impact. And so at the time, going back 5 years ago now, we became really obsessed around the concept of food insecurity in the United States. It's perplexing to think that the wealthiest country in the world has more than 50 million people on a daily, weekly, monthly basis that don't know where their next meals are coming from. And we've got more than enough food in our country to feed everybody. And so we couldn't understand why the existing solutions just were not quite getting the job done. And we had been starting to prototype different solutions to look at this problem in different ways, to think about what we could do to add to the existing set of solutions that our country relies on. And if kind of take a step back, you think about the current solutions that our country relies on are really kind of bucketed into a couple of key solution areas that are important to understand. One are government food assistance
Okay.
programs that do an incredible job getting resources out to those that need it most. And it's a necessary program, but far from sufficient to eliminate food insecurity.
Mhm.
The economists that have studied this space talk about needing to almost quadruple what currently exists as about $110 billion annual budget if we wanted the government food assistance programs to be able to solve this problem and eliminate food insecurity. And so that's an unlikely budget ask, given the nature of those programs. The other big solutions are the amazing work that food banks do to the tune of a couple $1 billion on an annual basis. Again, not quite enough to really move the needle here. And so we looked at that and said, there's got to be an opportunity to connect people to the right food in the right way, in a way that doesn't ask our lowest income community members to leave work early, to stand in line, to receive food that had been well-intentioned but donated without any concern for what people's disease risk factors might be or their nutrition requirements. And then worse, we're currently asking a lot of folks to put their dignity aside, to stand in line and ask for these donations and receive what is being given to them. That's not an aspirational experience for anybody. but people are obviously, willing to do it to be able to meet their basic human needs for themselves and their families. And we didn't feel that dignity needed to be something that should be sacrificed. And so we started to prototype different solutions for this. And as we got near the beginning of the pandemic, I think the pandemic, the early days, shined a spotlight on some of the fragility that a reliance on
Right.
those existing solutions was creating. And we, as a country, we saw those long lines, and we just, I think as a society, we're like, how is that happening? Why are we relying on these types of solutions? And that was the impetus that we needed to take some of the prototypes that we had been developing and get them out into the world. We didn't have a business model figured out at the time. The solution wasn't even fully ready for prime time yet, but we felt like it was our civic duty at Non Possible Labs to be able to help community members as best we could. And so we rolled out the first platform called Hunger Not Possible, which later got spun out of Not Possible Labs and is now Bento. But that first platform we provided to community organizations down in rural parts of Texas, where the schools were starting to shut down and putting people's children's free and reduced school lunches at
Yeah.
risk. And the platform was a simple one. It's a text message program that allows individuals in the community to place orders at local restaurants for healthier menu items that all happens over SMS text message, and all the payment is happening on the back end. So that no community member is being asked to pay, but the restaurants receive this order as an online order and get paid for it the same way they would any other online order. And it was a really frictionless
So when you were
way to.
let me ask you a question. When you were thinking about this, and you mentioned around human-centered design, how close do you get to the end? I'll call it the end user. Are you focusing and chatting with them? Are you cultivating relationships with the end users so that you can really understand what's happening in the mindset? Like, how deep do you go? I think that's really the question I'm trying to get to.
It started with talking to people in the community that were experiencing food insecurity before we even had a prototype, and understanding the role that that food plays, or in their cases, the lack of food, what
Yeah.
downstream consequences and issues that was causing for them. Some of the interviews that we did early on made it very clear to us that somebody who's experiencing food insecurity goes through a journey throughout the course of a month, which might be very different from the next person. In some cases, their food might run out toward the end of the month. In other cases, they're working 3-4 jobs, in a day, and just trying to get enough fuel in their own tank to be able to get through the day. What was a major barrier for them to be able to live the life that they deserve to. And so hearing this firsthand through one-on-one interviews was the earliest understanding of the gravity that we were dealing with, the importance of maintaining people's dignity in this experience and making it very convenient and frictionless to get access. Snap's an incredible benefit. It is extremely difficult for an individual who's living under these circumstances to navigate the healthcare system or the government bureaucracies in order to submit the right forms in order to get access to the SNAP benefit. I don't know what the latest stats are, but a lot of people in our country are eligible but not enrolled in SNAP for 2 reasons. One, they don't want to be stigmatized. And 2, it was just too much friction to be able to actually sign up for it. And that's, both of those 2 things are preventable and putting people's quality of life at risk.
And you feel like because those barriers sort of exist to the end user, and you're being able to sort of minimize that gap, in essence, are you taking those that need and aligning them to funding to help get people what they need without them feeling terrible about having to take advantage of this this opportunity for them to eventually get better?
That's right. Yeah, the experience of somebody who's on Bento makes it really easy for them to get access to the benefit. And when they place their orders, which are now curated grocery orders that come from their local nearby grocery stores,
Mhm.
They are placing those orders for food that's coming from the same grocery stores that we all shop at, the same
Yeah.
grocery items. They're just curated for their nutritional needs. And when they place that order and receive that order, whether it's a pickup order or delivery order, the person on the other side of that transaction does not know that that person is experiencing food insecurity, managing type 2 diabetes, or any number of qualifying factors that would have given them access to this benefit to begin with. And that's the experience that I think we can all relate to and appreciate. That's our daily experience for those that are fortunate enough to not be experiencing food insecurity. And we want to be able to extend that same opportunity to everybody. And food is a human right, and that food should be in line with how people experience it, both for their health reasons, their cultural reasons, and we know the role of food is an incredibly powerful resource to be able to build consistency, build the trust needed to help somebody on their healthcare journey.
So we've been in an interesting last, 36 months, and you've deployed this at a time where we've gone through a lot, as a nation. You've likely gathered a lot of data and a lot of information. What have been some of the key insights that you and the team have kind of come to from this information, from this data, and what do you see kind of it looking like in the future?
One of the things that we confirmed early on through our data, and this was not surprising, is that people will engage in this new approach and new solution because it is convenient. So being able to reduce the friction, that was one of our hypotheses. Will that lead to a greater uptick in access to the benefit compared to maybe some of
Yeah.
the gold standards out there like SNAP and other resources. And so we were able to confirm that and validate that. That was important. The engagement rates were through the roof. Not surprising because we're providing something of value that people really benefit from and recognize that benefit because food's important to everybody and people aspire to be patrons of either the local restaurants or the grocery stores for these food items. That wasn't surprising. The other piece that wasn't surprising was that engagement led to a reduction in food insecurity. That would be the expected outcome. What was surprising, though, was when we heard from our members early on that their experience was leading to a greater level of trust with the organization that was providing this benefit to them. So let me break that down for a second, because I think it's an important one, and it has led to our long-term strategy around the focus on healthcare plans. But when we first launched this and we were providing it to local community organizations like a Boys and Girls Club or a YMCA,
Hmm.
not only did those community members have a better feeling about that organization, but they were also better able to understand the other resources that that organization was providing to them. Could have been a Tuesday night
Yeah.
life skills class. And all of that was able to be communicated through our text messaging platform to the community member in real time while they're getting access to this food benefit on a daily or weekly basis. And so that level of engagement was something that we didn't anticipate. And that level of engagement led to a better sense of trust between a community member and that organization. And the light bulb went off for us. And we said, if we can enable that, we're going to be in a position to enable a greater level of trust between at-risk community members that might be completely disconnected from their healthcare and the healthcare system that is doing probably the best they can to try and engage those folks, but doing it fairly unsuccessfully because the only way that they engage them is when they show up in the emergency department. And there is not a lot of opportunity to build a lot of trust outside the walls of a clinic or an emergency department if it's not done with an eye toward what people really need. And going back to your reference to the Maslow hierarchy of needs, if somebody's stressed around where their food's coming from or they don't know where their next meals are going to be coming from, don't bother talking to me or anyone about the management
Right.
of a chronic
Right.
condition or seeking out preventive services or anything that might be in my long-term best interest. That's all off the table until you address my needs. And we want to make it really easy for the healthcare system to now take part in that and be positioned as the heroes in this story, because they're able to meet people where they are, address their basic needs. And then once those needs are being met and there's enough consistency, then starting to introduce the other healthcare resources that are critical to somebody's long-term healthcare outcomes becomes something that both sides can engage with.
And then do you find that as a result of, and we talked about this, earlier about building that relationship equity with that person, human to human, fulfilling the need, do you then find that you can swim further downstream where you can either be the facilitator of those additional services, or do you see, Bento participating in some way, shape, form in some of those services?
Yeah, the relationship equity that you referred to is critical. I love that framing here, because you have to earn the right to be able to engage with people on multiple levels. And access to food is the first touch point that somebody has. When somebody enrolls in Bento, they're placing their first order for their first grocery order within minutes of enrollment. And oftentimes what we hear from our members is, "Oh, this sounds too good to be true. There's no way this is going to work." And obviously, the proof is in the pudding for us in terms of being able to demonstrate to them that it is convenient, that it does work, and then they start using it regularly. And that's what starts leading to the first level of trust. And then making sure that people understand that we're there to help them and offer them opportunities to engage with different resources once they're ready to. And so we look at our role in that is connecting dots for people. We're
Yeah.
not there to recreate the wheel or to recreate disease management programs, but oftentimes the first step might be recognizing that one of our members hasn't been to the doctor maybe in a long time, let alone the last 12 months. And once there's enough consistency as it relates to their food and making sure that they've got a roof over their head, we can start introducing a conversation around getting you to the doctor and making sure that you've seen your primary care provider in the last 12 months at the very least. And so that becomes a framework that's built on trust, but we've got to earn it. We've got to continue to show up, treating people with dignity the way we all want to be treated, giving people things that they actually value intrinsically, and making sure that people are actually getting what they need out of it.
Yeah. And, when you mentioned just around the funding in terms of how the money flows, SNAP and some of these other government programs, how have you been able to navigate the business model around that? Because obviously, you're a startup, you're trying to align the mission and the purpose, and then also wrap in there that, hey, this is a business where we are trying to make money. Can you talk a little bit about the ponds that you've swam in, maybe some of the business models maybe that you have attempted that you've had to make adjustments to where you've landed now, and what makes you really confident that the area that you're in now is really the right stream that you need to be in?
That's such a critical question to address this topic, because when we first started down this road 4 or 5 years ago, we didn't truly understand how big of a gap there is in the funding related to food insecurity in our country. When those economists talked about needing an additional $300 or $400 billion on an annual basis, we were shocked and, quite frankly, didn't really know where we would be going to be able to actually, start closing the gap there. And when we first launched, the beginning of the pandemic, a lot of community organizations were receiving CARES Act funding. CARES Act funding was never meant to be a sustainable source of funding, but it was enough to cover the cost of these meals. Bento didn't make any money during that time. We just wanted to be able to have a proof of concept, iterate on the product, make sure that we were designing the product with the right needs front and center. And so the CARES Act funding that was flowing to community organizations to address their community needs like food insecurity helped to kickstart this for us. As we started to understand the implications of this and what it would mean to scale, we started looking at the appropriate budgets in our country to do that. And the reality is there's really only two budgets in our country that are large enough to handle the kind of absorption needed to be able to go from the 120 billion current budget of our government food
Right.
assistance plus the food bank work to the 300 or 400 billion needed. The defense budget in our country is large enough, but not all that relevant. The second budget is our $4 trillion healthcare budget, which if you look into how those dollars get spent, a lot of those dollars get spent on the treatment of nutrition-related chronic conditions that impact our most vulnerable at-risk community members. Those are folks that are either experiencing food insecurity and a number of comorbidities that those costs add up. And so we started to really understand the nuance of what the risk factors are associated with food insecurity. And it became as much a healthcare issue as any other issue. And so we made the very intentional decision to create a platform that would engage people in their healthcare resources. And we use food to do it. And so the byproduct of the successful outcomes on our platform is not just an improvement in healthcare outcomes, but an elimination of their food insecurity. And so we're able to justify the ROI against the healthcare budget because we're driving an improvement in healthcare outcomes. We're just using food as the entry point into being able to engage somebody that's otherwise fairly disengaged with their health and healthcare. And that individual becomes not only a high risk member from a healthcare perspective, but a very costly member as well to the government sponsored healthcare plans, whether that's Medicaid and Medicare.
Right.
And so we're focused on the Medicaid market right now because of the incidence of food insecurity with Medicaid. And we've started to become a reimbursable service to be able to scale the solution here. And so we've been growing pretty rapidly over the last 18 months as we've been treated as a reimbursable healthcare service through Medicaid plans now.
So let's talk about the importance of changes in policy and what that can and the implications of that, to you as a startup founder. And you've spent, time in DC walking the halls and knowing the intricacies of that. Do you find that that was like a competitive advantage for you? And to what degree now are you advocating and influencing policy? Talk a little bit about that.
Yeah, it's probably a not very popular approach for many entrepreneurs to run into the burning building of policy, but I've always actually seen policy as the potential for competitive advantage. One, understanding it so you can navigate it, and two, being able to influence it. And I think in both, for what we're doing at Bento, we're doing both of those two things. We're understanding where the policies currently support medically tailored nutrition support for Medicaid folks. The concept of medically tailored meals is not a new one. We didn't
Right.
start Bento to be a medically tailored meal company. That has become the designation that we've been able to get reimbursed by now. And so we're happy to be designated that in order to leverage those policies in the states where that's available. But being able to do that in the Medicaid space is a fairly progressive new approach to medically tailored nutrition support. And so being able to navigate that, each state is handled differently from a Medicaid perspective, which makes it a little bit difficult because you kind of figure it out in one state and then you got to figure it out in another state. And oftentimes those approaches might be very different from each other. But staying a couple of steps ahead of that, again, helps us create a little bit of a competitive advantage. I would say short-term competitive advantage because we got to expect that others are following in our footsteps and we, I think all benefit as a society when there's more companies focused on this area. So we're excited by that level of camaraderie, I would say, among the organizations that are focused on food insecurity and healthcare outcomes in this way. But at the same time, the policies in our country are still in the early days of truly understanding the right way to be thinking about food as both medicine and food as an engagement tactic in order to drive the best outcomes in a cost-effective way. And so there's still a bit of a gap in how policies have been written in terms of the dose and duration needed to achieve the optimal outcome, in terms of what's really required to take somebody who's low income on SNAP, low economic, socioeconomic status, maybe they're unemployed, and they're using the emergency department as their source of primary care. What's really required in that person's life, and how long is it going to take to get that person to a point where they're more self-sufficient and no longer reliant on the emergency department for their source of primary care, but also no longer reliant on Medicaid-sponsored nutrition, because they now have put themselves in a position to have socioeconomic status and a job that they're not just getting paid more for, but passionate about and living the quality of life that they deserve. And so our vision for Bento is to eventually graduate people off of needing government-sponsored food, but doing it in a way that is evidence-based in terms of what the dose and duration is needed to be able to get that outcome, not some arbitrary time frame that is set,
Yeah,
on a
hey, they're in
policy
here for
that
6
really is.
months, and yeah.
Exactly. For one person, it could be 6 months. For another person, it could be 24 months. And we want to recognize that everyone's starting in a very different place, but I would say the policies aren't quite there yet. So we see it as our responsibility to do the work, show up with the right level of information and data, outcome data for the policymakers to help set those policies and influence those policies for the betterment of society.
Yeah, I mean, it's kind of playing devil's advocate. What if things don't pan out in terms of policies that you want to move forward? Do you have contingency plans that are, secondary, tertiary plans that you've kind of put forth?
Yeah, at some level, I think there will always be some level of interest by the healthcare powers that be to want to engage patients. And so while that might not reach critical mass if the policies don't support it, I think there will be enough opportunity to position Bento as at, at least a cost neutral solution for those providers, those health plans, those integrated healthcare systems that see the ability to address some of the social drivers of health and connecting those people not just to the solutions to address their urgent needs, but then connecting them back to the healthcare system. That feels like a durable approach and solution. I also think that there's some interesting applications to what we have built. We've built integrations into the entire food supply system when it comes to restaurants and grocery stores, and have an incredible amount of access to inventory with the ability to curate that inventory. There's a lot of use cases for that
Yeah,
capability that might fall outside of our focus area right now. We're not naive to the potential there. We are staying really focused because as a startup with limited resources and what feels like an audacious goal ahead of us, we're staying focused. But there's an immense amount of opportunity to explore additional uses for what we have built. That all still focuses on food first. Low income community members are not the only people that benefit from curated nutrition done in a really simple, frictionless way. And so there's a lot there. Probably won't get into it today,
yeah,
on this show, but the potential is a big one. And we see, once we've achieved our mission within a low-income community and eliminated food insecurity for 50 million people, there's still more than 250 million others in our country that could benefit from exactly, what I was just saying. So there's a long roadmap there, and fortunately, we've got an incredible team. I'm surrounded by people that inspire me on a daily basis to do things that I never thought were possible, and so I'm pretty confident that with the folks that we have and the passion that everybody shares for this, we're gonna find a way to do it.
Yeah, this isn't, I mean, this isn't a job for you. This is a calling. This is something that goes deep for you. It's very, very clear. What, if you were to kind of peer around the corner 12 months from now and we're just sort of sitting back here jamming out, chatting, what needs to happen in order for you to feel really satisfied about the progress of Bento?
Right now, we're expanding throughout the state of California. We've been focused on the California market because of the foothold that we have here, where we started, the policy that support what we're doing, the resources that exist for us here. But 12 months from now, I think we'll be a reimbursable service in other states. And we'll leverage the playbook that we've developed and that we've refined to bring it to other communities and other states, in a way that allows us to identify community members that are at risk earlier, getting them engaged in a healthcare benefit that starts with food, and then making sure that their patient journey and member journey aligns with their needs first, but also drives to an improved healthcare outcome, and setting up some rigorous controlled studies to actually demonstrate the cost effectiveness of this with our different partners. I think that's something that over the next 12 months, we're putting a lot more resources against, and so we will have a lot more to share 12 months from now when it comes to really showing up with the policymakers with some hard and fast data that makes this easier policies to write.
Amazing. So um, how can folks continue to follow your journey? Obviously, we're not a year ahead, but how can they keep up to date with the work that, you and the Bento team are doing? So give us a little commercial.
People can follow us online on all the social channels. Our website is www.gobento.com. We just brought on our first director of marketing, and this is in an effort to help build some of the case studies and communicate some of the work that we've been doing, that we've been fairly, I would say, internally focused on. We're going to start exposing more of that externally and sharing some of the work that we're doing more publicly, so people will have more to follow, now that we're in a place where we can talk more publicly about some of this stuff, which is a really exciting place for us to be.
Amazing. Amazing, Adam. It was so awesome to have you come on and just give us the vision, give us some of the things that you've been working on, and honestly, even some of the pivots that you've had to make. So, for those that have tuned in, if you happen to find this conversation really helpful for you, my small ask is, would you mind sharing it? Whether it's liking it, commenting it, um, it takes a village to make stuff move forward. So I'm grateful when we can make a contribution to that in some standpoint. So great to have you, and I'm looking forward to our next conversation.
Thank you, Michael, for having me on the show.